All right. Welcome now again. I'm just going to, briefly go over the benefits, and I will skip the part about the health insurance so you guys can hear that directly from Jenny. But, I wanted to put this slide in here because I remember meeting Robert and Sarah years ago, and their big thing was they wanted to make their plan healthy and they wanted to make their plan affordable. And I don't know if you all remember what health rates looked like for RMD years ago, but they were so high. And, RMD was willing to do whatever they could to try to get those premiums more in line. And they did so by really investing a lot of money in the cost of employees' health insurance premiums. And I'm saying they did a big amount. And that in turn has just given you guys some amazing renewals over the years. So I wanted to point this out because in 2019, RMD, by switching to Select Health, received a 4.3% rate reduction. It's not really heard of, but sometimes when you switch carriers, you do get a rate reduction. But in 2020, -5. You guys remember that last year? And then this year, -2. So you guys have run really well. You're doing a great job as a company. I mean, part of these increases are also due to how the utilization is, and employees have been doing really well. There are things that you can take advantage of that, Jenny can talk about too, but very impressive to see that. So you have the two health plans, and like I said, I'm not going to spend time on talking about those two because Jenny will briefly talk to you about the co-pays, but just want to remind people about Connect Care. And this is the portal for Connect Care. And this is the online, I'd say the teledoc that is available through Select Health. But it is such a great service, and it is so easy to use. And starting in 2021, it's actually going to be at a zero copay. So there wouldn't be any reason for anybody not to take advantage of this. You can call a provider, you download the application on your phone, you put in your policy number, and then you let them know you need to speak to somebody. You get a high quality provider, within minutes, 24 hours a day, and that provider can prescribe medication. They can, they can say, no, I think you really should go to the emergency room. No, go to the urgent care. But these are one of those tools that I would definitely use before you, go to the urgent care, go to the emergency room, because a lot of these things can be handled over the phone, and they can actually, like I said, they can fill prescriptions as well. So just want to point that out, and also point out it's going to be at a zero copay, even on the high deductible health plan. So that is also nice for those people on that plan. They're not even going to have to pay anything for the teledoc feature. The dental plan is staying through Dentist Direct. And just as a summary, you guys have, familiar with this, but there were two things that we were able to change this year. One being the fact that your annual maximum went up to $1,250 from $1,000. So RMD was able to negotiate that. Rates stayed the same. And the other thing is I don't know how many people were aware of this, but you used to have cleanings at one every 6 months. And sometimes that's not always convenient. If someone's going out of town, then they want to get in to see the dentist before they leave, and they might be in there before that 6 months clock ends. So they no longer have that limitation now. It's just 2 every 12 months, and they're not going to keep track of the 6 month limit. As a reminder, your cleanings are covered at 100%. Your cavities are covered at 80%. Major services, which are going to be like crowns and bridges, are covered at 50%. The deductible only applies for those things of cavities and crowns. Other than that, it's an amazing plan. You do have a discount on orthodontia. And the other nice thing is there's no waiting periods for dental work. So that's a really nice plan on the dental. And then for the vision, that remained the same as well. Just wanted to point out a couple of things, that you do have an eye exam covered under Select Health, so that's great. But if for whatever reason you don't want to use one of the providers through Select Health, you can go to a provider through this plan at a $10 copayment. You have $150 you can use towards your frames, or you can use them towards your contacts. So it's up to you whether or not you want to do frames or contacts, one or the other per year. So they won't let you do both. And then for lenses, you just pay a $25 copayment. I want to point out that if you do go out of network, you can do that. You can see a provider outside the network. For the contacts, it's not reduced too much. It's down to $112. For frames, it's definitely reduced. It's only a $75 allowance, so it is cut in half. So think about it before you go out of network, because it could make, you know, a difference of how much it's going to cost you for those frames. And then also the copays for the lenses are quite different. Instead of being a copay, they'll only pay up to 25, or they'll only pay up to 40. So I definitely, for your glasses and frames, use an in-network vision provider. And then on, the life insurance. This is another really nice benefit. It's through MetLife. This isn't changing, but just as a reminder, you can purchase up to 5 times your annual earnings, up to $500,000 for life insurance. The guaranteed issue is at $100,000, but keep in mind, if you didn't go on this plan when you're initially eligible, then that guaranteed issue doesn't apply. However, I would still encourage people to take a look at these numbers, because they're still very competitive with what you can see out in the market. And you have an opportunity to buy this insurance at a low cost. And if you do, if you are required to fill out the health statement, it's a simple form. You answer some medical questions, send it in, and they'll let you know if you are approved for that amount. You can buy the spouse up to $100,000 and your kids up to $10,000. And the portal, for those of that have been through the portal before, it will automatically calculate those amounts. You use a slider rule that goes across, and you can see what the different amounts are. It will track what you had enrolled in last year, and you can decide if you want to change that for the next policy year. And then I'm not going to spend a lot of time on this FSA, because I know Ruta is going to be going through on the FSA. Just want to point out a couple of things. Keeping in mind is that it is pre-tax dollars, so any dollar amount you want to put in a flexible spending account is deducted from your paycheck before taxes are calculated. And the other thing is that if you have an HSA plan, a high deductible health plan, and you know RMD is contributing money towards that HSA, you cannot select a normal FSA. It will be called a limited benefit FSA. And so what you can do is you can say, okay, I don't want to use my HSA dollars for dental or vision. I would rather have another way of setting money aside into a plan that's pre-tax. You can use that limited benefits for dental vision expenses. Plan carefully, because it's use it or lose it. There is a rollover that I know Ruta will talk about. And the other thing I want to point out, it's not portable. If you change jobs, then you forfeit that money in the FSA. Whereas with the HSA, it's a little bit different. And with the HSA, it still saves you money because you can deduct it pre-tax, but it is portable. So the minute those dollars are put into your account from RMD, that money is yours. And if you change jobs, that money continues to go wherever you go. I know RMD is changing their philosophy this year on the contribution. They are still contributing money, and it's all listed on the portal. And what I do want to tell you that if you have any questions as you're going through open enrollment on how that works, feel free to reach out to our office, and we can assist you with those questions. This type of plan can also be really nice, like as far as an improved retirement account, because you can max out your contribution on this, and keep in mind that when you hit age 65 with normal retirement plans, any dollars that you pull out of a retirement plan, you're taxed on, because you were taxed on it when you put the money in. With the HSA, if you take the money out after age 65 and it is to use to spend for qualified medical expenses, that includes COBRA premiums, Medicare premiums, long-term care, you'll never pay taxes on it. So it's really smart to kind of think through this and say, well, do I want to utilize this also as a way for me to have money as I get older, and know that I'm never going to have to pay taxes on it? And that, that's a pretty big deal on the health savings account. So just remember, on the open enrollment, we list the medical, dental, and the life insurance as passive, which means if you do nothing, your benefits will be rolled over as they are now, because those benefits are not changing, they're just enhancing. But in order to be in the FSA or even the limited benefit FSA or the HSA, you have to re-enroll. And that's super important, because the way that RMD is strategizing their HSA contributions this year, you're going to want to go in there and do something so you can get the most benefit out of those dollars that RMD is spending. So the other thing that we always want people to do is be able to acknowledge the compliance notices every year, just to say that they're aware that there's compliance notices. So even though this is passive, I'd still encourage people to do it, because if you have a high deductible health plan, you'll lose out on any dollars for that HSA. So, you know, go through there if you can. So are there any questions for me?
Celia, I had one question on hearing benefits. Would those be covered under FSA?
And HSA, both.
And HSA. So if someone has an HSA and they did a limited FSA, would those cover hearing?
No, limited FSA, I don't think. Ruta, can you unmute yourself and confirm if the limited benefit will cover any hearing aids, or is it just the dental and vision? Oh, she's not unmuted. It's pretty, it is, and by the way, Ruta, it's star six to unmute if you get it. But I'm pretty sure, Sarah, it's just the dental and the vision, okay, unless something has changed on that.
When she gets on, we can double check that with her.
Okay, sounds good. All right, let's see if Jenny was able to get hers fixed. I'm going to stop sharing my screen, Jenny, and see if you can get on. Are you there?
Yeah, let me try here and see if I got it figured out. Okay, can you see?
Okay, do what Jenny you can do, because I know you're good at this on figuring out, but can you change, you can maybe that where it says click to add notes or something, you can actually, I think, make it so it's smaller, and then you could just use the sidebar and just go through it that way, and then it is hiding your notes. But you're not gonna be able to see them, but I'm sure you've done enough times.
Yeah, I can't, so I'm not sure what screen you're seeing. So you're seeing the main screen, and then on the side has a side note.
Yeah, yes. Yeah, it has actually the slides, yes.
So do you have two screens? Maybe you're sharing with us the screen that you don't want to share.
Yep, I do have two screens, but I don't know why it's sharing that way. I'm so sorry.
Okay, let me do this, Jenny. If you give me a second, I'll pull up your slideshow, because you send it to me. Let me see if I can find it. You just tell me to switch to the next slide. Just a minute. Let me find it.
I've actually used it since then.
You pardon? Oh. But you want to just use it just so.
I go through with the slides or with the notes. It's totally fine. Okay. So sorry for the hiccup, everyone. Thanks for coming to this virtual open enrollment meeting. And I'll go through these slides real quick. Some things Celia has touched on, and so I'll try to be real quick through those, and other things are going to be new. So first thing with your plan through RMD management is you are offered the Select Health Med network, which has 7,200 providers. You can live and work anywhere in Utah and access these benefits. It's 100% of Intermountain Health Care, but you also have access to Huntsman Cancer Hospital, Primary Children's, and Moran Eye Center. A little bit Celia had talked on is their telehealth off benefits, and you do have those out-of-network benefits. So your benefits have not changed. Are my slides changing?
Yes.
Yes.
Okay. Okay. So you still have the two plans that are offered. You have the traditional $1,500 plan. That's a $1,500 individual deductible, the $3,000 family. On this plan, you're going to have your co-payments that are pre-deductible. So if you go to see a primary care doctor, you have a $25 co-payment before deductible. If you see a specialist, you have that $45 co-payment. As still you mentioned, the Connect Care is now at a 0 copayment. And then your urgent care, you also have prior to deductible. However, if you do go to the emergency room, that will be after deductible.
Hey, Jenny, I think your slideshow will work, by the way, if you just click up, not where it says from beginning, if at the very top, but not, just go up further at the top menu. Keep going up, over one. See that icon with the screen in it? It will work now, because I can see that it's now in bold. If you want to, just move over a little bit. Keep going. Oh, say from current slide. Just go down on the next menu, sorry, and then go to from current slide if you want to do that. Go to the left, up there from current slide.
Oh.
Nope, go up.
Oh,
there you go. Yeah, click that.
When I click it, it's not doing anything.
Okay, it looked like it was going to work. Yeah. Okay, never mind. I'll be quiet then.
No, you're good. Okay, so we're on to the HSA plan, which is your high deductible health plan offer. This is the one that you would use and pair with your HSA account. So this one has a little bit of higher deductible. You have the $4,000 individual deductible, the $8,000 for the family. On this plan, you have co-payments, but those only apply after deductible. So if you meet your deductible, then you have a co-payment for your primary care doctor. Otherwise, you would pay the allowed amount on that claim, and it would go towards your deductible. But the good news for the 2021 is that you do have a 0 co-payment for any of the Connect Care, even on the high deductible health plan. Again, your urgent care and emergency come after your deductible. So during the pandemic, it really made all of us kind of be creative, and even in the healthcare industry. So there were many providers who they had to find other ways to connect to their patients. So we've expanded a lot of our cares through our Connect Care platform. So our Connect Care platform doesn't only apply to urgent care. You can have virtual office visits with your providers now. Not all providers offer that, but there is that ability for some providers. And so you can still have that Connect Care or telehealth type service without it being an urgent care visit. This again is talking about Connect Care. This is a big one. I know Celia is big on this. It's such a good benefit. And if you haven't taken advantage of it, you really should. It's that 0 copayment for any urgent care, even on your high deductible health plans. One thing that's new this year is we actually are offering mental health services as well through the Connect Care. So that's a big change. You would just go on to the Connect Care site. We do have a single sign-on now, which means your password and login that you use for your Select Health account would be the same password you would use for the Connect Care. So you don't have to remember different passwords all along the way. Another free service is our Health Answers. The Health Answers it's kind of like an Ask a Nurse. It's a 24/7 nurse line that's staffed by Intermountain nurses. You can call them 24/7. Another good benefit to this is there is a separate mental health helpline as well. So you can call the nurse line or you can call the mental health line 24/7 and get the help that you need. We do want to make sure that everyone's taking advantage of their preventive care offerings that are on the plan. Your preventive care is going to be covered 100%. For example, you have your mammograms, your colonoscopies, things like that are all covered 100%. In addition to our COVID testing and treatment is all covered at 100% this year. So the most important number for you to remember through this is our customer service line. So the 800-538-5038. If you have that number, you're going to be able to get the answers to any of the questions that you have, whether they can answer it or they need to warm transfer you to another department. They will get you to the person that needs to answer your question. So again, member services is going to talk to you about any of your claims questions. If you have a service that you're wondering if it's covered, you can call member services and they can help you at that 800-538-5038. They're available from 7 a.m. to 8 p.m. and then they're also available on Saturday from 9 to 2. Another service that we have is our member advocates. So member advocates can help you find any of your providers that you need to see. They're really helpful. There can be times where you're calling around trying to get into a doctor's office and there's no availability for you. If you call member advocates, They sometimes can help you get in sooner than you can when you're calling on your own. And this number, you can call them directly, but remember, you can always call our customer service lines and they can directly connect you to member advocates. One more access point for you to reach Select Help is our online customer service. So with our online customer service, you can do a live chat with us. You can also request a call back. So if they're, you know, if you're going to take lunch at 12:30 and you don't want to forget, you can schedule that time, and our customer service reps will actually call you at that specific time. One of our most popular tools is our cost estimator tool. This tool, you can go in on either the web or on your application on your phone, and you can put in the services that you're going to be having, and it will take into account your specific deductible and out-of-pocket that you've met and give you a cost estimate for the procedure that you're going to be having. So it's super helpful. It kind of gives you the ability to shop around for your medical services and make sure you're getting the best care and cost. Your pharmacy is also a big one, and we try to have several different ways that you can fill your pharmacy needs. So you can do your retail 90, so any of your maintenance medications, you can get in a 90-day fill. You can also have it home delivered through Intermountain Home Delivery, or you can still go into your local pharmacy to pick up those prescriptions. And the one last thing I want to talk about is our Select Help discounts. So these are discounts that are offered to our Select Help members just for being a member. You're offered these discounts. So typically things that aren't going to be covered by your health insurance plan, but we offer discounts. For example, LASIK. It's not something that's covered on the medical plan, but we do have providers that offer discounts to Select Health members. So you go to selecthealth.org and you can look at our discounts. And this has been updated a year or so ago, and it has a lot more discounts than it did prior. So when you have a chance, just get out there and take a look and see if there's anything that works for you. So with that, real quick run through, are there any questions that anyone has?
I had a couple that came to me, and then I will unmute everyone and see if there were any others. On the Connect Care, that's at no cost all the way through 2021. That's correct.
Right.
And then, so it requires you to go or have some kind of device where you have video with it, right?
Yes. So you're going to want to, you can use a tablet, a laptop, a phone, any of those devices, but it is a face-to-face virtual type visit. So it's not just on the phone. You actually are seeing a doctor face-to-face, and they're doing diagnostics that way. Okay.
And then the other question was where you talk about the COVID treatment and testing is at zero cost. Is that also through 2021 or just through 2020?
So as of now, we don't have an end date on that. And so I anticipate as long as there's a need for this to be covered 100%, it will be.
Okay. All right. I am going to try and see. Well, I don't know if I know the technology to unmute you guys. So if anybody wants to unmute themselves and ask a question, now is your chance to ask a question on health insurance.
So is there coverage for compound pharmacies or discounts for compound pharmacies?
So there is coverage for compound pharmacies, but you want to make sure that you're using a contracted compound pharmacy. Offhand, I don't know the list, but you can call into our customer service, talk to our pharmacy team, and they'll be able to tell you what pharmacies would be covered.
Okay, and Jenny, that did remind me of another question that came into me. Where can people access a current list of providers?
So if you go to selecthealth.org, along the top, it's going to have find a provider. You can either select for a specific provider in a specific location, or you can also choose to download the most recent provider directory.
Okay. Any other questions on medical insurance, vision insurance, dental insurance, or life insurance? If you think of some, please feel free to send them to me in the chat. And Celia and Jenny will still be available later on in our meeting.